If you ever wondered the difference between studying nursing in Nigeria versus studying nursing in the United States, please make sure you watch this video to the very end, because me and a particular nursing student in the United States are going to be doing a comparison between studying nursing in Nigeria versus studying nursing in the United States.
Audio Jungle. Audio Jungle.
Hello guys, welcome to my YouTube channel. My name is Krypton. If you're a new subscriber, welcome to this big family. Please make sure you subscribe. I beg, subscribe. And if you're a returning subscriber, you guys are my big family, my OGs. Welcome back. So for today's episode, I'll be doing a comparison video about a nursing student studying in Nigeria and a nursing student studying in the United States. I'll be taking the parts of the nursing student studying in Nigeria because, of course, I'm a nursing student studying in Nigeria. And with me, my friend Jollof Nurse, she'll be taking the parts of the nursing student studying in the United States. She is a final year student studying nursing in the United States.
Hi guys! How are you all doing today? Welcome back to another YouTube video. My name is Abigail, aka Jollof Nurse. I am a nursing student who is in a senior year of nursing school. I'm so excited, I'm almost done. And welcome back, and welcome if you're new. If you are new here, please don't forget to subscribe and let us all hit the notification bell so we can get notified when I post. Okay, so let's get right into today's video. So the mode of admission, just like in anywhere else, there's community colleges, there's universities, and there's even state universities. If you apply for nursing school in a community college, you're going to get an ADN, which is called Associate Degree of Nursing, which differs from what you would get if you had gone to a university, which is called Bachelor's Degrees of Nursing. I am based in Massachusetts, in case I forgot to say that. I'm based in Boston, Massachusetts. So we definitely have community colleges and we have universities. So if you're applying to a community college, which is where most people like to do first, whether they are based in the United States or they are coming from outside the country, and this is because it's able to save them some money. They're able to get some money saved, because when you go to a university to start as a nursing student, what you have to do is you have to take your prerequisites before you're allowed to start your nursing classes themselves. So why not just take the prerequisites in a community college and then transfer those credits to a university? Or you might as well finish your prerequisites and start your nursing classes in a community college and get your associate degree in nursing before you can start working as a registered nurse. You're ready to sit for the NCLEX, work as a registered nurse, and your hospital might pay for your bachelor's degree in nursing. Like, that's going to save you money. But whichever which way, the most important thing is saving money. So you hear me talk about prerequisites. What are prerequisites? So prerequisites are courses that you need to take before you can be allowed to start your nursing classes. Take this as the fundamentals, the foundations of what you need before you can start your nursing classes. So I've listed some prerequisites here. So some of the prerequisites are Intro to Biology, Anatomy and Physiology 1 and 2, Microbiology, and Inorganic Chemistry. All of these courses I had first listed, they must be done with lab. So if you have anatomy but you don't have lab, it will not be accepted. So make sure you do them with lab. And there's another exam called the TEAS exam. So this is an exam that you must sit for in order to apply for most community college, for most schools, most nursing schools in the US. So this test consists of English, math, science, and reading. And in the community college where I was in Boston, you had to get 60% on 4 of them. So English, math, reading, and science. So the science is based on like anatomy and physiology, things that you've learned, and English, reading, and math. So these are the things that you need.
In Nigeria, for you to become a nurse, you have to go through 2 platforms, which is either you go through the university or you go through the College of Nursing. Then I'll go straight to how you can enter being a nursing student in Nigeria. For the university aspect, you have to have your O level. There's some specific like 5 subjects that you must have and at least the minimum credit you must have, which is maths, English, chemistry, biology, and physics, where you must have it. So you must have your O level. Then after obtaining your O level, then you must write your JAMB. After writing your JAMB, you write your post JAMB. Then by God's grace, you'll be given admission to study nursing. So that's it. And of course, there's a specific cut-off, because studying nursing in Nigeria, especially university platform, it's very, very competitive, very, very competitive. So you have to study very hard. So you get your O level, you write JAMB, write your post JAMB, then you'll be admitted. Yeah, when you reach the cutoff. Then talking about the College of Nursing, you also have to write your JAMB also. Because now, like I said, if you check my former video, I talked about the recent updates in the nursing curriculum in Nigeria, whereby all school of nursing are being transformed into College of Nursing. So JAMB is now required for you to enter into a nursing school, a College of Nursing in Nigeria. So after writing your JAMB, then you also write the school exam. That means the College of Nursing exam. Then after writing that, then it now depends on the College of Nursing whether you're going to do an interview or not for you to enter it. And of course, the selected people will be chosen. So there's just two different platforms where you can enter being a nursing student in Nigeria: University and College of Nursing.
About school fees. So one of the community colleges here, the school fees for one credit is $436. And as an international student, you are required to take 12 credits in order to maintain your status in the US. So if you are taking 12 credits, that would be about over $5,000. And so this is in a community college for 12 credits. Imagine going to a university, that is going to be almost double that amount.
I'll start from the university platform, and the school fees I'll be saying here is not the specific one, it's just a range, just for you to have an idea how much you're going to spend when you want to study nursing in Nigeria. So for the university aspect, we have the first one, which is the Federal University. And the Federal University is kind of cheaper because it is owned by the government, and the range is around 40k to 80k here, 40,000 naira to 80,000 naira per section, which is in a year. It is a government one, and that is why it is very, very competitive. A lot of people want to go there. I'm talking about the second, which is the State University. That one is less cheaper compared to the Federal University one, which is around 180,000 naira to 300,000 naira, because this university is owned by the state government. It's owned by the state government, and it's not that competitive like the Federal University one. And the third one, which is the most expensive one, is the private university. That one is owned by an individual firm or a private enterprise. So that is it. It's owned by a private enterprise, and of course, it will be very, very expensive, very, very expensive. And the range is around 800,000 naira to 1.5 million naira section. That is per year. That is very, very expensive. You see, nursing is very expensive in Nigeria. About the school fees for College of Nursing, talking about which is the first one, the Federal College of Nursing, that is around 80, that's a range of 80 to 200,000 naira, 80 to 200,000 naira for the Federal College of Nursing. Then for the state-owned, is around 200 to 350,000 naira, 200,000 naira to 350,000 naira. And for the Ogbonge, which is the private college of nursing, which is very, very expensive, it is around 500,000 naira to 800,000 naira for a private college of nursing.
About practicals, the practicals that we do here, I feel like that's one thing we have in common. The practicals are mostly for my school, we did practicals in the beginning of the semester in my fundamentals class. So the practicals that we did in my fundamentals class, we started doing practicals of taking vital signs. So you will get tested on how to take vital signs. So you get tested on listening to a blood pressure manually. In a hospital, you can just use the cuff and the machine will bring it out. But no, you have to listen to it with your stethoscope and the sparrow. You know the name, I'm not going to say it. So you're going to listen to that, vital signs, respiratory rates, heart rates. You're going to count them manually. You're going to count the respirations too, and respiration, heart rate, and blood pressure. I think those are the major ones that they watch us on. And then after that, you have to do another practical, which is sterile technique. This is where you are placing a Foley catheter into the female's anatomy. You're placing it, and you have to make sure that you do it in a sterile technique. They're going to watch you on how you clean and how you insert, how you don your gloves, where you put it first, and don't, all those basic, don't touch it with a dirty hand, have a dirty hand, and the things that you do. And then after that, they're also going to watch us on another practical that is called medication administration. And just like in every of these practicals, you greet your patient. I feel like that's the beauty of nursing. I love nursing so much because we are the same all over the world, whether you're in Nigeria or you're in the US or you're in Germany, anywhere. Because like that, you're going to greet your patient, and then we are going to do medication administration. So they're going to watch us on how you take your medication. You're going to do your rights. You're going to do the right person, right patient, right drug, right dose, right reason. They're going to watch you on that, how you administer the medication. They're going to ask you some questions like, where can you give injections? What kind of medications can you crush? And they're going to ask you maybe side effects of medications too. So you want to make sure that you know those. So that was the practicals that we did for fundamentals. Then we did practicals for health assessments. And the practicals that we did for health assessments was like, first of all, we did a system where you have to assess that system. So I remember for me, like my instructor made us like pick a raffle. Whatever you pick is what you do. I picked respiratory system. So I had to assess my patient's respiratory system. I had to assess how she was breathing. I had to assess her respiratory rate. I had to assess I have to do like oh, you gotta help me. Like all those things, the lungs, listen to the lungs. You want to check for bilateral movement, bilaterally symmetrical. If it's not bilaterally symmetrical, like lung expansion, I have to check for all of that. I had to do that, and then we had to do one more assessment under health assessment, which was the head to toe assessment. So you assess the patient from their head to their toe. You assess everything the same way you grade a patient. There's a video recording, so my instructor is able to watch us through like a computer, and then we'll get our grade after.
Practical aspects, like in the College of Nursing, based on our own experience, the very first thing is that like whatever we are being taught in class, we will demonstrate it in our demonstration room. Demonstration whereby like we have to like deal with simulators. We just call it Mr. and Mrs. Jones, whereby we do it. I still remember the very first practical I did then was about vital signs, taking temperature, blood pressure, checking the pulse. First, we did it in the demonstration room. Before then, we were being posted for our first clinical posting in the world, whereby like we saw the life experience, even serving of bedpan, bed making, and feeding the patient. All those practical were first done in the demonstration room before we were being posted for our clinical practice in the world to have a life experience.